Hello everyone. Today, we're diving into the world of a medication called gabapentin enacarbil, commonly known by its brand name, Horizant. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Gabapentin enacarbil, known by its brand name Horizant, is an extended-release tablet that falls under the category of anticonvulsants. It works by affecting the way nerves send messages to your brain. This medication is primarily prescribed for the treatment of restless leg syndrome, RLS, and postherpetic neuralgia, which is pain that follows an outbreak of shingles. Horizant was approved by the FDA in 2011 for these uses. Gabapentin enacarbil is designed to provide prolonged relief by releasing the active ingredient over an extended period, offering consistent therapeutic effects throughout the day. Warnings: Gabapentin enacarbil comes with its set of precautions. It's important to note that this medication can cause significant drowsiness and dizziness. Therefore, it's advised not to drive or operate heavy machinery until you know how the medication affects you. Additionally, gabapentin enacarbil is not recommended for individuals with severe renal impairment or those on dialysis. Patients with a history of depression, mood disorders, or suicidal thoughts should use this medication with caution, as it may increase the risk of suicidal ideation. Before taking this medicine. Before starting gabapentin enacarbil, several factors need consideration. Inform your healthcare provider if you have any allergies to this drug or its components. Given its impact on the kidneys, those with renal impairment should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring of your condition is advised to ensure the medication's effectiveness and safety. You should not take gabapentin enacarbil if you have severe kidney disease or if you are on dialysis. Inform your doctor if you have any respiratory issues, as gabapentin enacarbil can depress respiratory function, particularly when used with other central nervous system depressants. Additionally, disclose any history of substance abuse or dependency, as there is a potential for misuse. Side effects: all medications can have side effects, and gabapentin enacarbil is no exception. Common side effects include dizziness, drowsiness, headache, and nausea. Some individuals might experience swelling in the legs and feet or experience weight gain. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. More serious side effects may include mood changes, such as increased anxiety, depression, or suicidal thoughts. If you or someone around you notices any drastic mood or behavior changes, seek medical attention immediately. Additionally, there's a potential for respiratory depression, especially when used with other medications that affect the central nervous system. Always inform your healthcare provider about any new or worsening symptoms. Interactions: gabapentin enacarbil might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. This medication can enhance the effects of alcohol and other CNS depressants, increasing the risk of severe drowsiness and dizziness. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking gabapentin enacarbil. The typical starting dose for treating restless leg syndrome is 600 mg once daily, taken with food at around 5 p.m. For postherpetic neuralgia, the starting dose is usually 600 mg in the morning for 3 days, followed by 600 mg twice daily. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. Do not alter your dosage without consulting your healthcare provider. Avoid: while on gabapentin enacarbil, it's advisable to avoid alcohol as it can increase certain side effects such as dizziness and drowsiness. Given the potential for dizziness, it's wise to rise slowly from sitting or lying positions to prevent falls. Additionally, avoid taking antacids within 2 hours before or after taking the medication, as they can reduce its effectiveness. FAQ: many wonder about the age restrictions for gabapentin enacarbil. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing: that wraps up our overview of gabapentin enacarbil. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.